Hello, everyone. It's December the 14th on Tuesday. Since we've been with you the last time, we've lost 52 additional West Virginians. I hope you join me in prayer and everything for all these great people that we've lost and all their loved ones. The 5,056th West Virginian we've lost is a 61-year-old male from Nicholas County. The 5,057th is a 70-year-old female from Preston County. The 5,058th is a 75-year-old male from Berkeley County. The 5,059th is an 82-year-old female from Ohio County. The 5,060th is a 71-year-old female from Jackson County. The 5,061st is a 94-year-old female from Ohio County. The 5,062nd is a 72-year-old male from Mason County. The 5,063rd is a 78-year-old male from Marion County. The 5,064th is a 73-year-old male from Raleigh County. The 5,065th is a 64-year-old female from Preston County. The 5,066th is a 67-year-old female from Hampshire County. The 5,067th is a 72-year-old female from Fayette County. The 5,068th is an 80-year-old male from Ohio County. The 5,069th is a 48-year-old male from McDowell County. The 5,070th is even worse, a 37-year-old male from McDowell County. The 5,071st is a 70-year-old male from Kanawha County. The 5,072nd is a 62-year-old male from Mineral County. The 5,073rd is an 89-year-old female from Summers County. The 5,074th is a 91-year-old female from Brooke County. The 5,075th is a 69-year-old male from Morgan County. The 5,076th is an 82-year-old male from Kanawha County. The 5,077th is a 72-year-old female from Kanawha County. The 5,078th is a 66-year-old male from Wyoming County. The 5,079th is an 83-year-old male from Wyoming County. The 5,080th is a 72-year-old male from Monongalia County. The 5,081st is a 53-year-old male from Ritchie County. The 5,082nd is a 65-year-old male from Putnam County. The 5,083rd is a 69-year-old male from Mercer County. The 5,084th is a 37-year-old male from Randolph County. The 5,085th is a 63-year-old male from Wyoming County. The 5,086th is a 60-year-old male from Upshur County. The 5,087th is an 85-year-old female from Ritchie County. The 5,088th is a 56-year-old female from Taylor County. The 5,089th is a 69-year-old male from Preston County. The 5,090th is a 63-year-old male from Berkeley County. The 5,091st is a 51-year-old male from Mercer County. The 5,092nd is an 84-year-old male from Randolph County. The 5,093rd is a 51-year-old male from Fayette County. The 5,094th is a 49-year-old male from Cabell County. The 5,095th is an 85-year-old male from Clay County. The 5,096th is an 84-year-old female from Marshall County. The 5,097th is a 55-year-old male from Mercer County. The 5,098th is a 62-year-old female from Jackson County. The 5,099th is a 45-year-old male from Monroe County. The 5,100th death in West Virginia is an 80-year-old male from Marshall County. The 5,101st death is a 75-year-old male from Raleigh County. The 5,102nd death is a 73-year-old male from Hancock County. The 5,103rd death is a 77-year-old female from Marshall County. The 5,104th death is a 61-year-old female from Raleigh County. The 5,105th death is a 64-year-old male from Mingo County. The 5,106th death is a 52-year-old female from Wetzel County. The 5,107th death is a 79-year-old male from Fayette County. The 5,108th death is a 72-year-old female from Mercer County. The 5,109th death, an 82-year-old female from Wood County. The 5,110th death, a 63-year-old male from Fayette County. The 5,111th death, a 94-year-old female from Mineral County. The 5,112th death is a 57-year-old female from Harrison County. The 5,113th death is a 79-year-old female from Logan County. The 5,114th death, a 78-year-old female from Greenbrier County. I've told you this many, many, many times. 5,114 deaths. 92.2% of those people were unvaccinated. Active cases in West Virginia are 8,002. The new positive cases, 781. We didn't test a lot because the daily positivity rate is at 10.29. Our cumulative rate is 6.32. We have 295,869 people that have recovered from COVID or the Delta variant. We're up over 600 people hospitalized now, 633. 201 in the ICU units and 123 on ventilators. The number of unvaccinated now is growing again. For a while, the folks that were in our hospitals or on ventilators or in the ICU units, the number was probably about 20%, maybe even 22 or 24% were vaccinated. Now that's changing again. Now we're getting more and more folks vaccinated, and all of a sudden this is starting to change. Now, get this, now there's only 18% of our people in our hospitals have been vaccinated. All the rest, 82% are unvaccinated. There's only 15% of the people in our hospitals that are on ventilators, in the ICU units. 15% are vaccinated. 85% are unvaccinated. These numbers right here tell us we're making progress about getting our booster shots out and getting our people vaccinated, because it was going the other way. We were up to, I don't know if we were up to 24% of the people or whatever it was in the hospitals or in the ICU units. 24%, I think, was the number that were vaccinated. And now that number has dropped to 18 and 15%. So we're making some headway there. We got 16 red counties and 4 green counties. We got 15 outbreaks in our school community, 13 counties and 409 confirmed cases. I remind you all the time, if you're 65 and older and you've got a symptom at all, get tested. The antibodies will save your life. You've got to remember that. You've got to remember that. Face covering, 65 and older. If you have any compromising issue whatsoever, lung, heart, diabetes whatsoever, and you're going into a crowd of people, especially at this holiday season, and you're going into a crowd of people and everything indoors, wear a mask. Okay. You know, the anniversary of when the COVID vaccines came out has just passed, has just been with us. You know, West Virginia, you led the way. You led the way with the entire nation. And I'm going to read to you now just these notes because I think they're really impressive. I really do. We led the way for the entire nation right out of the gate. While the other states spent weeks cutting through federal red tape, West Virginia was getting the vaccine out to our most vulnerable people. We launched the Save Our Wisdom campaign. West Virginia was the first state in the nation to offer vaccines to residents of all long-term care facilities across the state. We were first in the nation to launch an online statewide COVID-19 vaccine pre-registration system. We also provided early vaccine access to first responders that were on the front lines in the battle against this pandemic. We offered vaccines to all teachers, service personnel, and other school employees 50 and older so our children could get back in the classroom. We were also one of the first states to offer vaccine incentives, an incentive program to encourage our people to get vaccinated. You remember Beat 588 bad. And that was the number we wanted to get vaccinated. And we had the Call to Arms initiative. And now, of course, we're in the third round of Do It for Baby Dog. Save a life, change a life. Fast forward to today, 1 year later, and we've administered in the state of West Virginia, we have given shots. The total number of shots we've given is 2.2 million doses. 2.2 million doses to a resident population of 1.8 million. That's a lot of people getting 2 shots. We've still got a ways to go. We're at 82.4% of the 50 and olders and 90.2% of the 65 and olders, but we've still got work to do, don't we? We've still got a bunch of folks out there that absolutely we need, especially to get boosters in their arms, and we've got still many, many that we still need to get across the finish line and get vaccinated. I'd like to take this time to really thank our doctors, our nurses, the health departments, pharmacies, medical providers, and everyone who's helped us get shots in arms, especially the DHHR, the National Guard, and the Joint Interagency Task Force. You know, absolutely, it has taken a real effort to coordinate all this, and these folks have done an incredible job. And so absolutely, please, please, please take time if you could over this holiday period to thank these great people. And from the bottom of my heart, I truly thank them all. You know, many, many West Virginians have stepped up and gotten their vaccination. Now, I've said over and over and over, you know, I stand strongly behind our freedoms. And I absolutely should, I think without question, we should continue to do exactly what Baby Dog does. And that is make each other smile and love each and every one of us. Love us all. Absolutely, that's what we should do. We should love one another, and we should try, especially at this time of year, to make each other smile. It's been tough. It's been really, really, really tough. We've all stood together. You know, we had different opinions and everything, but we stood together, and we listened to the experts, and we're going to get through this. It's been really tough. Please remember all those that we've lost, and absolutely, please remember, if you could, to just continue to consider this vaccination. And absolutely, without question, those of you that are eligible for the booster shots, you need to do it. You need to do it right now. Okay, I guess I'm going to jump all the way down to this. Pfizer said last week that a booster shot of COVID-19, you know, the booster shot of their COVID-19 vaccine gives them a protection level, an increase of 25-fold. It's unbelievable, unbelievable how that booster shot will help you to fight off this terrible possibility of this terrible pandemic, you know, jumping on you. And absolutely, if you happen to have it, and especially if you're 50 and older, 65 and older, it's a tough fight. It's a really tough fight. Let me tell you this. Yesterday, I was talking to a young lady in the medical field. You know, she has, I think she has 3 children. You know, her oldest son has COVID right now. He's been vaccinated, and he's 12 years old, and he's got COVID. And you know what she said? She said, it's been tough, but I know without question the vaccine has really worked, because the very kid that he was with has got COVID as well, and he's not vaccinated. And he's having a really, really tough time. My child was vaccinated, and my child absolutely is getting through this without too much trouble. The kid that is his buddy that he was with wasn't vaccinated, and he's having a heck of a hard time. Think about it. Just think about it. Okay, the vaccine's eligibility is 5 and above. All of our information's up there. The Do It for Baby Dog Round 3 is now closed, and we'll be awarding these $10,000 education savings funds, and we'll be doing that very, very soon, and as well as the hunting and fishing license, lifetime license and everything. We're going to have a special party at a school that we'll be announcing and everything, and that'll be toward the end of this week, and with all kinds of wonderful stuff. And as schools, this school has won the grand prize, the grand prize of $100,000, and there is a grand prize that is awarded to a student that is equivalent to just that, $100,000 education savings fund. It's amazing. It's amazing stuff. Okay, our Do It for Baby Dog Senior Center edition is getting ready to fire up and everything. Now we're going to target our seniors, getting them across the finish line on our booster shots and everything, where anyone and everyone that is eligible will get paid a $50 prepaid Visa card. That'll come out almost instantly, and we will be awarding a $100,000 prize to our 4 top senior centers, and across our state. And so we'll be, there'll be more information coming up, and the deadline for this is December 27th. Is that correct? Okay, so we'll get more and more information about that and everything. But now we're going to jump a little bit different. We're going to go towards trying to get more of our seniors across the finish line on these booster shots. I remind you about getting tested. I thank Fruith. I thank Walgreens for all you've done. We've got 45 outbreaks in our long-term care facilities, none in our church community. Fantastic. We got 126 inmate cases now and 27 staff cases. We'll stay on top of that. Corrections continues to do a fabulous job. I remind you about getting your flu shot and everything. If you'll get that flu shot, you can get it at the same time as your COVID vaccine. Our grand families, tomorrow is the last day to pick up this $150 school voucher. You've done good. We still need you to do more. And so get online and take advantage of this. From a standpoint, I say it over and over about our renters and our landlords. There's money waiting on you if you'll call us and get in touch with us, where we can, see if you qualify for this. There's millions of dollars sitting here in the state right now that we can go out to our people, and I love it when we put those dollars out into the hands of our community, because the multiplier effect on those dollars is really significant. So please take advantage. I want to read this to you on our unemployment rate. We have another, and I can't be more proud of this. There's no way. There's no human way anybody could be more proud. I mean, just think about it. Really, I hate to say this, but when I ran for office, one of the things that I came up with is that we put on the billboard is tired of being 50th. Well, you haven't heard much about that recently, have you? West Virginia absolutely is killing it, doing absolutely fantastic. We know there's all kinds more to do. We know there's still people out there that are really hurting, and we're after it. We're trying in every way we possibly can to reach all. And I'm not going to quit until we get all. But now get this. We have another all-time state record to announce. West Virginia's seasonally adjusted unemployment rate dropped 0.3% to 4.0 in November, the lowest seasonally adjusted unemployment rate in state history. We broke the previous record of 4.3 in October. The number of unemployed state residents decreased by 2,800. The total employment grew an additional 1,700 over the last month. Our unemployment rate has now decreased 19 straight months. 19 straight months the unemployment rate has decreased. The national average is at 4.2. We're better than the national average at 4.0. We also broke the all-time record for our non-seasonably adjusted unemployment rate for the third straight month in a row. It's amazing. It is really, really good stuff. Now, just get this. Along the way, lots of people had to push the right buttons, did we not? We made West Virginia more business friendly. We stood by our energy industry. We made historic investments in tourism and broadband. We revamped our whole transportation infrastructure through the state, through Roads to Prosperity. We all pulled the rope together and stayed together in this terrible pandemic. And we continue to try to make good, sound decisions as we continue to pump out surpluses that will enable us to do more and more and more goodness in West Virginia. West Virginia, where the net today of the whole thing has never been a better time for jobs in the state of West Virginia than there is right now. And we want to continue to grow on this and attract everybody that can come to this state. There's so much more right in front of us. But boy, I'll tell you, it's really been a wonderful turnaround and an absolute wonderful ride. Okay, Paul Hardesty, I've appointed him, to the State Board of Education. I've known Paul a long time. He filled the seat of author Stan Maynard. Now, so Paul, I'm sure, will do an incredible job, and he's got all kinds of experience in education. He's been on the Board of Education. He's been the principal of the County Board of Education. Paul's been a senator in the state. He's been a champion all the way for education, and I know that Paul will do a great job. So congratulations, Paul. I'm honored to appoint you, and I know you'll do a wonderful job. Last thing I've got is there's a public service recognition ceremony today. Now just think about this. We're recognizing people that have served this state for 30 plus years today. We're doing other things that I'll tell you real quickly about, but 333 folks have served this state for in excess of 30 years. We're doing a lapel pin, we're doing another honor of a certificate for people that have been with us for 20 years. It is unbelievable. And we're also doing something that is, we just, I guess, started last year and everything, called a Shining Star Award, for people that have been here any number of years. People that are truly just that, shining stars that have done phenomenal work. We're going to give away 12 awards for that today, and you can watch it all as we live stream it. You can watch the live stream of the ceremony on the Department of Arts, Culture, and History social media. We also have one man that has worked for the state of West Virginia for 50 years. It is unbelievable. So for all those folks, we thank you. Your service is not absolutely forgotten, and we appreciate you more than I can possibly tell you. So thank you so much. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor said, we have gone through another large number as far as the number of people who've died in the U.S. from COVID-19. We've now passed 800,000 deaths. And just to take a moment to reflect on that, 1 out of every 100 people over 65 years old in the U.S. has died of COVID-19. 3/4 of our deaths are in people over 65 years old. 1 out of every 420 people in the U.S. has died of COVID-19. We are sure to pass 1 million people here coming up. And as we look at the numbers, we also see, perhaps not surprisingly, but very, very unfortunately, that even with the vaccines available, we've had more deaths from COVID-19 in 2021 than we had in 2020. about 385,000 deaths in 2020 from COVID-19, and about 405,000 deaths so far in 2021. We know that many states, again, are struggling with hospital numbers that are exceeding their highest levels, particularly states that have gotten colder, Michigan, Minnesota, Maine. But we also know that despite having vaccines and boosters available, that the uptake of boosters and the uptake of vaccines in our younger population has really not been what we would like to see. And as we look at our over 65-year-old population, understanding, as the governor said, that as we look at vaccine potency, that starts to reduce after about 6 months after the second dose, particularly for Pfizer, and after 2 months for Johnson & Johnson, a little bit less for Moderna, but still reducing in potency, that we really do need the boosters. We need the boosters to keep people in that age group from becoming sick and going to the hospital. And we also need that in order to approach what is coming next, which is the Omicron variant, which right now is in over half of the states in our country and will absolutely be seen in West Virginia as well. So as we look at our hospital numbers, we have 643 people in West Virginia hospital beds, which is up 10 from yesterday. As the governor said, that a great percent of these people, about 88% or so of these folks in our hospitals, are unvaccinated. As we look at around the world, we know that 2 vaccines is not sufficient to really protect us from the Omicron variant if those 2 vaccines are 6 months ago or longer since the second dose. And we also know that our RT value, our reproductive score, continues to go up, is 1.2 today. So all of the signs and all of the other states that come before us are telling us that we are looking at right in the face of another surge here in West Virginia, initially from the Delta variant, and then very likely to be followed by the Omicron variant. And the Omicron variant, just to give you an idea about its infectability, in the United Kingdom, the Omicron variant is doubling in numbers of new cases every 2 days. So it is going to take over from the Delta variant in the United Kingdom. Studies just out from South Africa suggest that there may be somewhat less virulence, severity from the Omicron variant. But remember, this is in a population that is generally younger and healthier than ours is. And South Africa has also seen a 20% increase in hospitalizations in that same study in children under 18. So it is so important to get our children vaccinated. It is so important to get the booster shots, and anybody over 65 years old. And in West Virginia, as we have said many, many times, about 95% of our deaths or more are in West Virginians over 50. We have a very vulnerable population that has other medical problems. We're the 3rd oldest state in the nation. So there should be no reason at all why people don't run to get their boosters if they're eligible, run to get their first and second vaccine doses, because we know that if the hospital systems get overwhelmed, all of our death numbers go up, all of the problems, not only with COVID-19, but with other acute medical illnesses and chronic medical illnesses like heart disease, strokes, heart attacks, car accidents, et cetera, become more problematic. So it really is the time, West Virginia, for us to really start to take those precautions to protect our hospital systems and protect each other. And please also remember to get your flu vaccine. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to reinforce a couple of items that the governor and Dr. Marsh discussed, we are continuing to see significant upward movement in our transmission rate, up to 1.2 today, and that is brought along also with increased hospitalizations. From the time we came on the press conference, we got updated numbers, and as Dr. Marsh pointed out 643 individuals now in the hospital, and the percentage of individuals in ICU and on ventilators is increasing significantly. In addition to that, we're seeing approximately 76 patients per day to 85 patients per day in our hospitals each day. Additionally, with COVID, anything over the number of 60 puts us in a significantly challenging position with our hospitals. There is some good news related to vaccinations. We have surpassed 70% of our over 18 population with at least one dose. So we see West Virginians are continuing to get educated and take the vaccine. But as both the governor and Dr. Marsh pointed out, the speed with which we are getting individuals vaccinated initially, as well as booster doses, is not keeping up with the pace we need to blunt the disease and to slow down this pandemic. So West Virginians, again, as Governor Justice and Dr. Marsh point out, as well as the rest of our team, please get vaccinated and please get booster doses as soon as possible. And we need to continue to do a better job to educate the parents of our young people and get more young people vaccinated. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Morning. I just want to reiterate the importance of the flu vaccine this year. This year, we're reporting only about 17% of our total population has received the flu vaccine compared to 44% last year at this time. So I would like to remind everyone that the flu vaccine is a yearly vaccine. It does reduce hospitalization and illnesses, and we do have an aging population. So please go out and get your flu vaccine. It's available at pharmacies and your doctor's offices. Thank you.
Thank you, Dr. Amjad. Secretary Bill Crouch out of Prior Engagement will rejoin us on Thursday. We'll now go to questions from members of the media. The first today from Jasmine Aduse with WDTV.
Hey, good morning, everyone. Good morning, Governor Justice. Good morning, panelists. I wanted to talk a little bit about the anniversary as well, the vaccination anniversary. One of the first people to receive the vaccines were healthcare workers. So I guess for Dr. Clay Marsh there, if you can kind of just explain how things are going there from that standpoint, and getting those boosters and how important that is as well. Thank you, guys.
Dr. Marsh.
Well, thank you, Jasmine. Thank you, Governor. Jasmine, as you know, we have access to very safe, very, very effective treatments for COVID-19, and those are vaccines. And so as we look at the uptake of the vaccines, we know that in our most vulnerable population, our older population over 65 and over 50, then we've seen very good uptake of the vaccines. And we know that this has led to really saving a lot of lives and helping a lot of people. What we know now, though, is that people that are eligible for the boosters for these vaccines who qualify, which means that they are 6 months from their last dose of Pfizer or Moderna, or 2 doses from their dose of Johnson & Johnson, that they are eligible to be vaccinated and that they have full potency, full protection against getting infected with COVID-19 and getting sick with COVID-19. They really need to be boosted. We also know that healthcare workers, it's really important for them to get their full vaccination series as they have done and to be boosted as well, particularly as we see another round of the Delta variant that's likely to come to West Virginia. And we know that our hospitals are already having challenges with people who are, the staff who are either having had COVID exposures or infections, or who are not anymore working in the field or at the places in West Virginia that we really do need to help, because the capacity of our hospitals is really directly proportional to the outcomes in any surge for COVID-19. And as the governor has said many times, and we have as well, that when hospitals become overwhelmed, then it's not just problems with COVID that becomes an issue. It's problems with other acute medical illnesses like heart attacks and strokes and car accidents that become an issue, and treatment for chronic diseases like cancer and heart disease and others. So really, really important for all of us to really double down to make sure that we're fully vaccinated, make sure that our children are fully vaccinated, because that's a big part of the spread. We know children certainly can get the Delta variant and the Omicron variant when it comes and spread COVID-19, and also to keep people from dying from COVID-19 in West Virginia and beyond, and also get their flu shot. Thank you.
All right, thank you, Jasmine. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. And first of all, congratulations to General Hoyer for the Spirit of the Valley Award they'll be getting tomorrow here in Charleston. It's well earned. So congratulations, General Hoyer, and thank you for all you've done. I have a question for Dr. Marsh. Dr. Marsh, there are some conflicting, at least on the surface, they appear to be conflicting details about the Omicron variant. That health experts in South Africa say that of more than 200,000 cases that they've seen that were positive, the risk of hospital admissions among adults was lower than 30%, 29%. So that's leading some people to say that Omicron may be a milder variant. But if you could please, and you touched upon it in your remarks, but if you could break it down in layman's terms for me, what we're seeing in South Africa may be a result of their natural immunity because they've been hit by several waves of corona, and also their younger population, which may not have some of the comorbidities that we are seeing in West Virginia, which may react differently than what's happening overseas. So while the virus itself may not be having the same impact in South Africa that it will be having here, I guess is what I go and get to the bottom line, is we can't just rely on what we're seeing in other populations because they have other circumstances.
Dr. Marsh.
Thank you, Governor. Thank you, Kenny. So Kenny, what you said is right. We know that the Omicron variant seems to be able to reinfect people, even who have relatively recently been infected with the Delta variant. Very, very high numbers of people in South Africa and Africa have been infected with the Delta variant of COVID-19. And despite that recent native immunity, those same people seem to be getting reinfected with the Omicron variant. These people are younger and generally healthier. Remember, West Virginia, third oldest state, and the state that was at least ranked by the Kaiser families early in the pandemic as the most vulnerable state. And we know that the Omicron spreads very, very rapidly. As we said, every 2 days, the number of cases are doubling in the United Kingdom, which is a place that's much more heavily vaccinated than West Virginia is. So even though South Africa is reporting there are lower numbers of hospitalized people, they are also reporting about 20% increase in the under 18-year-olds that are being hospitalized with Omicron, by the way, in that same study. But the concern is with the incredible rate of transmission, of infectiousness of the Omicron variant, and a very vulnerable population that we have in West Virginia with lower vaccination rates, and also in people that are naturally older and sicker, then we anticipate that we will see problems from the Omicron variant. But Kenny, as you know, and we said earlier, all the surges that are coming now for the states that are colder than us, Michigan, Minnesota, Wisconsin, Maine, Rhode Island, are coming from the Delta variant. So we're anticipating we're going to get another surge initially from the Delta variant, which is going to cause a lot of problems. And that's why we need to get boosted and immunized here in West Virginia as soon as possible. And after we really get hit by that, at least predictably, then we're going to see the Omicron variant come in and cause us even more problems. So right now is the time to get ready for what we hope we can avoid by really seeing high levels of vaccination and boosting.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. question about the relatively low number of people that are electing to get the booster. Are they becoming anti-vaxxers, or do you think we have COVID fatigue sitting in here and people just tuning out the message and saying, I've had enough of this, I'm moving on? Illogical as that may be. Thank you.
Paul, let me take a stab at it, and then I'd like General Hoyer to jump in as well. Paul, here's what I think. I think you got a lot of folks out there that, you know, the federal government has been, you know, its own worst enemy in many, many ways. They've given us a lot of information and then had to go back and recorrect and reset, and Dr. Fauci over and over and over and on and on and on. And in all of that, a lot of our seniors, in my opinion, you know, especially those 65 and older or 50 and older and everything, they basically, and I'm primarily targeting the 65 and older, but an awful lot of them feel like if they got vaccinated the first time and they got their second vaccination, if it was Moderna or Pfizer, and most of them that's what they got and everything, well, they're okay. They're okay. And a lot of those folks have really not heard the message that really and truly they're not okay. They're not okay. Really and truly, they're walking around almost as if they were, for the most part, not ever even vaccinated. And so with all of that, I think that's the number one issue. We're getting a whole lot more of them. We're getting a lot of them, you know, relatively fast. Nowhere close to as fast as we want. But I do not think at all that these people have become non-vaxxers. You know, now, General, maybe you can join in. Maybe you have a different opinion, but that's what I think.
No, sir, Governor. I think you're right on track, and I just reinforce a couple of things that the governor pointed out. I think confusion and misinformation are the biggest enemy that we have in this pandemic, and part of the reason that we do these various incentive programs and marketing programs and ring downs to phones is to make sure people are getting information from us and from appropriate sources. I think a lot of older West Virginians are confused and have been confused about what they need to do, and we continue to try to do programs to address that. And to the governor's point about the anti-vaxxers, we still see in our data that only about 17% of West Virginians related to themselves are just absolutely not going to get vaccinated. So there are still people out there that are willing to be educated and to look and see how things continue to move. And our biggest challenge right now, as the governor pointed out earlier, is we've got to educate the parents of our younger population because, as Dr. Marsh pointed out, they could be significantly challenged by the next variant coming.
All right, thank you, Paul. Next, we'll go to John Mark Shaver with West Virginia News.
Good morning, everybody. Last week, we talked about the tabletop exercise you guys were planning to do this week. I was wanting to know if that had happened already, and if it did, you know, what projections you got from it. And if it hasn't happened yet, is there any data that reveals what we're facing in the coming weeks? Thanks.
General, please.
Yes, sir, Governor. So the tabletop exercise actually will be conducted tomorrow. So we'll have more information from that. We're also continuing to work with our data analytics team to see what other things we can do to improve our projections going forward. So we'll have more information at the end of the day tomorrow on what we see from that tabletop and things that we need to address. In the meantime, we're starting to prepare for other activities to include training opportunities for individuals that we might need during the surge as well. Thank you.
Thank you. And next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Hope you've all been well. Governor, are there particular plans for spending what remains of West Virginia's share of CARES Act money? Looks like as of about now, the state still has about $127 million remaining. As you may know, student leaders at West Virginia University have been hoping some of that money might be used to support student mental health programs. Any particular plans? Thank you.
Brad, yes, we met last week. We've been meeting, and we've been monitoring these dollars all along and everything. I think, if you could just hold up just a little bit on that, and Thursday there's going to be a bunch of announcements and everything. Thursday we're hoping to make a great big announcement in regard to that. But nevertheless, we're monitoring it. We're absolutely going to make sure that we handle these dollars and handle the store exactly the way we should have all along. And so we'll be making another announcement on Thursday.
All right, thanks, Brad. Governor, I'll turn it back to you.
Well, just in recapping, and I always try to do this, and I pay really close attention to all the experts and the words they say. I'm going to miss this a little bit, but I think, I don't know how profound it could possibly be to think that 1 out of every 421, I think is what Dr. Marsh said, people in the United States of America have died, have not just gotten COVID and gotten sick, but have died, and 1 out of every 100 that are 65 and older have died from this. At 1 out of every 100 in the U.S., 65 and older have died from this. And we absolutely keep messing around with it. I mean, we have a way to stop this. We really do. If we had everybody vaccinated, we absolutely could put an absolute stop to this, or a percentage that was significantly higher than we are today. We could shut this thing down. Now, with all that, I've said it 1,000 times, we don't need mandates. What we needed was just good, clear advice from our federal government. And by getting all that confusion of advice, we got people scared. When people don't trust, they get scared. And when you get scared, you usually shut down, stop, and everything. Well, we're going to continue the battle now, because the battle is tougher now. Way tougher than if you would have just been told the absolute truth, been transparent, know we can make mistakes, know we don't have a playbook, but been told the truth, not a political thing, just the truth. And many times we weren't told that. And so with all of that, now we have fear and skepticism. And we have the battle so much more difficult to get people across the finish line and get them vaccinated. Dr. Marsh also said today that we in West Virginia are likely to see another surge. That's not good news either. Absolutely, without any question, this number, remember the transmission rate number at 1.0. That's the breakoff, 1.0. That's the tipping point. Now, if you go from 1.0 to 1.05, or you go to 1.09, it's a big move. We have gone all the way from 1.0 to 1.2, and that's not good. It's just not good. So with all of that, the only last thing I would say to you is Dr. Amjad said that in the state of West Virginia last year, we had 44% of our folks that had a flu vaccine now, and I think that's the number she said. But now this year, we have 19% that have a flu vaccine. I want to tell you without any question, I've taken the flu vaccine. Without any question, you should take the flu vaccine. You should also take the other vaccines, and especially the boosters. We're going to keep at it. We're going to keep at it, and we're going to get through this. That's all there is to it. Without any question, today, the most pressing thing to me today is to get the people that are vaccinated, get their booster shot. We're making progress. I'll promise you we're making progress by just looking at the percentage of hospitalized people. If you look at the people that are in the hospital today, 18% of them have been vaccinated, and all the rest of them, the whole other 82% are unvaccinated. If you go to the ICU unit, 15% of them have been vaccinated, and 85% of them have been unvaccinated. Those percentages are moving more closely to the fact that if you're vaccinated and you've got your booster, you're probably not going to be in the hospital, and you're probably not going to be in the ICU unit. Just as simple as that. Nevertheless, that's all I got. It's a great holiday time of year. I think this, and I want to say this to our young people, because this is really important too. I think Christmas Eve, now I could be mistaken about this, but I think Christmas Eve is when we have more deaths on the highways than any other day of the year. I think that's right, or it was a long time ago, I think. If that be the case, our young kids need to be really, really careful, especially our young kids. And we need to really watch about going to a party and getting overserved or whatever it may be. We absolutely need to watch that and getting out on the roads, and God forbid, don't get out on the roads drunk. But with all that, I would just say at this incredible, incredible, joyful time, you got to be careful, just one step more careful. And the last thing is, please remember all those that were devastated by these incredible, incredible tornadoes. We've reached out to the governor of Kentucky. We've reached out to all these different people, and through emergency management, through our highway people, to all kinds of different folks, we've reached out and everything and offered up our assistance and help through our guard and whatever it may be. Remember those folks too. It's a tough time of year, tough time of year. So nevertheless, a joyful time, but be a little more careful. Thank you so much.